Hey, what's going on, everyone? Welcome back to another episode sponsored by GeriatRx and the Deprescribing Accelerator. Hope you guys are having an amazing holiday week as we approach this season of gratitude and thankfulness. I am really here today to share some of the gratitude that I have in this season as a prescriber and as an entrepreneur in this space in pharmacy. And well, it's been easily one of the best years of my life. Period. They're just all around. And so I really come today just very thankful, just thankful to have a platform, thankful to have people passionate about deprescribing in this world, passionate about the patients I'm able to help and serve as a geriatric pharmacist who is inclined to helping my community. And so this year has been really a monumentous swing of growth in personal development for me. When you're in business, it's literally like your own self-development course. Like being an entrepreneur is your own self-development journey. Frankly, your everything you do in real life, everything you do in your personal habits, all those things come to play in business. And really, I wouldn't have been able to grow in this realm as a pharmacist, as a patient advocate, as a caregiver advocate, if I didn't have this platform to serve others outside of my traditional 9 to 5. So, I want to welcome you back to another episode of the Red Pill versus the Blue Pill. If you didn't know, Red Pill versus the Blue Pill, but it's from The Matrix, my favorite movie of all time, and where we dispel this healthcare myth that everybody needs a pill for every ill, a prescription for every ailment, and whatever cute little poem you want to add. I'm tired of that. And so I am not anti medicine, as I preface in all of my live events, but I am anti this knee jerk response for us to prescribe and overtreat for every health conditions, particularly in our seniors, right? Particularly in seniors that I feel are over medicated. Hey, what's up, Mariko? Appreciate you joining in. But yeah, I'm really today is a gut check, not just for me, but for everyone in this space who's just considering entrepreneurship or even just considering how to start serving in a greater purpose of their being, in alignment with the creator, in alignment with you as a clinician, like what got you into your profession, period. And is that still reign true when you show up every day serving your patients, right? Does that still align with who you are as a deprescribing advocate, or as a nurse, social worker, pharmacist, whatever? I think COVID has blown a fuse on how broken this health system is, and so we're losing staff left and right. So how are you in all the madness and craziness finding what pays the bills with in tune with what you stand for morally as a clinician? And for me, of course, that's deprescribing. Of course, that's educating people in such a way where they can start asking those questions on if this is appropriate for me now or my loved one later. But that level of advocacy to me is what wakes me up every day. It's why I'm happy. It's why, I'm going to these conferences. It's why I'm learning so much as I meet more and more passionate entrepreneurs in this space, but also more and more patients, more and more caregiver testimonies, more clients who just share the same frustration I see as someone who is a part of the healthcare system, right? So this is the season of gratitude. So yeah, of course, I will always say now is the time to start thinking about our real purpose as we work in these geriatric spaces or senior spaces, or frankly just health profession period. I mean, it was 2 years ago, what, 2 years ago, well, I guess now it'd be three, because I stepped down from Walgreens, from pharmacy manager in 2019 in December, and officially launched GeriatRx in 2020 around April. So yeah, I guess it has been about 3 years of doing this and trying to figure things out along the way. And I am just grateful that point of frustration with retail pharmacy, but just the frustration I had with myself, like how I even showed up for my friends, my relationships, my own dog at the time. It was lackluster. And I kind of felt like in my 34 years of life, I really didn't start becoming Delon until these last 2, 3 years in business, where I had to literally sit with myself and look at my flaws, look at my strengths, look at my wins, embrace learning how to take time off, which I failed at miserably, of celebrating the wins and taking my own time off. Um, yeah, Raji. Yeah, appreciate you commenting, man. We are quick as a system to add a pill to remedy the side effects of a new med, as opposed to stepping back and seeing ways to augment their treatments to maximize utility and minimize side effect profile. Thank you, Dr. Raji. Yes, you're so freaking right. I mean, we got to change this medication mindset. It doesn't have to be so let's just go straight to a treatment. And I firmly believe that we, especially as clinicians in the senior care industry, but more importantly, pharmacists, I think, are well equipped to quarterback this deprescribing movement that I feel, I'm clearly the face of, but there are so many others in this space that are passionate, and they're looking for ways on how to do this on a broader level. So when I meet, consultant pharmacists who work in ALFs and SNFs and nursing homes, they're doing all that they can, but they still feel it's not enough. And they feel trapped. They feel stuck. It's like you've been with this LTC for 20 years, and unless you have a cohesive environment where the prescribers, the nurses, the techs, the medical assistants, the director of nursing, I mean, everyone on board has a deprescribing mindset, then there is no excuse why a 65-year-old patient, 70-year-old patient in a memory care unit is on 20 drugs. Okay? There's no excuse. There is really no excuse for someone to document no changes needed, nothing reported, or your gradual dose reduction has been ignored as a recommendation for months and months on end. I am tired of just saying I documented it and moved on. Like, that was all I did in retail. That's all I did was, oh, well, I tried to get that Percocet stock, but whatever. and it's like you're fighting against the system. So until there's an environment systemically where an entire interdisciplinary team is approaching deprescribing in those care settings, in those advanced SNFs and LTCs and continuing care home models, there's so many different tangents of those type of care models. But truthfully, the pharmacists I meet are burned out because it's like their recommendations fall on deaf ears, or the system they're in is like a consistent, like, oh my gosh, I stopped this 3 months ago. Why is this being put back on? It's like your deprescribing effort was just done in vain. It was just redone in a quick represcribing of the prescription. So the system, guys, is the problem, right? We are inherently, reactively, frankly, giving our recommendations after something is written versus being bought in prior to the prescribing. And I think that needs to change, or at least it needs to be something. I'm not necessarily saying all pharmacists need to be prescribing pills. I don't quite believe that. I don't think that's my scope, and I don't want that liability, frankly. But there needs to be a consensus between the drug experts and the caregivers and patients, along with the care team. So medicines affect almost every role in the care team. It affects the physical therapist. It affects the occupational therapist if it needs to be one. It affects the cognitive behavioral therapist. It affects, of course, the primary care provider. The medicines can affect, of course, the quality of life for our patient or the caregiver. It affects whether grandma is able to remember her grandbabies that winter, that Christmas, that Thanksgiving. So it affects everyone, the social workers involved, the nutritionists. I mean, the medicines impact so much to a patient's life when they are in harm's way, of course, when they're doing more harm than good. That impact plays a role in everyone's job. So if we are not inherently ruling out potential harm with deprescribing, then literally we're adding work to people's plates because we're not using the best kept secret in pharmacy, which are our geriatric pharmacists who know how to deprescribe. They are taught this, but our power of deprescribing, I think, is dulled because we have a system that doesn't really incentivize it. And I think that's BS, of course. There are ways to work around it with certain types of incident to billing codes, but clearly we, and you and I both know, it ain't sufficient to necessarily build a practice on unless you're seeing hundreds of patients. And I'm not big on seeing tons of people for minimal reward and quality that I can deliver consistently. I'd rather see less people and give the best quality I can. But as you know, we have a fee-for-service care model. So I say, screw that. Let's create a model where providers in the deprescribing space can charge for a deprescribing service and charge a cash fee, whether it be retainer model, subscription model, one stop and done model. To me, it doesn't matter. What matters is there is such an overwhelming need. There is such an overwhelming need for people who want pharmacists to go the extra mile that I am literally at wit's end on which direction to go to. Seriously. Like there's like a coalition of geriatric care managers I can just create a referral system based model with. And it's something that I know you all can do the same using the very same skills you have now. There are, of course, the nursing homes, like education for their staff on file. They could be doing in-services for providers who are new to deprescribing or don't even know that this is an actual methodology that can be adopted and can actually benefit the patients, right? Our goal is harm reduction and hopefully improve quality of life. But we're also looking for ways to how are we gonna show that there's a bottom line significant impact from deprescribing? How are we showing the value of reducing hospitalizations, right? Reducing falls, reducing worsening cognition, reducing opioid-related emergency admittances. Like, how are we showing the impact or even the cost savings on the patient? And the health system has a greater whole with using deprescribing. And that, my friends, is why now is the time to start leveraging our expertise and selling it as a high-ticket service, because this is truly what it's going to have to take for us to really change the view and perception of pharmacists. I mean, we're revered and we're not even respected to that level. Yet we are still one of the most trusted health professionals in the country, but we still don't get that level of billing respect or even autonomy given the skill sets we have. And yet we literally saved this country from COVID. We've vaccinated millions of people, cost savings of billions because of the vaccinations we've put out there. And we don't even get reimbursed for their vaccinations. I guess maybe now, but before we couldn't even bill for that. So I am tired of our value being undermined by outdated and archaic Medicare laws, CMS laws, nonsense lobbying powers from the Medical Association that refuses to see the cost savings and impact and intrinsic value pharmacists have to healthcare as a whole. So screw the system. Screw it. Just go ahead, start your own thing. I'm not saying it's easy. I'm saying just do something different that aligns in your God-given purpose for deprescribing. Whatever avenue you use, I don't really care what avenue you use, as long as you are giving that value and serving in a way that aligns with your core being and aligns with what's best for our aging population. And I say it all the time. There are way more overmedicated seniors than there are the lawn Canterbury. So I cannot help them all. But I say this to basically segue to the fact that there is such a demand for people who just want to get their loved ones off of medications. And it's unheard of. It's crazy to me. It's like, I feel everyone wants to be off of meds, yet they're not thinking to have their own pharmacist on retainer that they can contact, just like how we have lawyers or Legal Shield or even the old school doctors that used to make house calls. They have a ton of concierge doctors. They got a ton of concierge nurses. Why not have a concierge pharmacist, right? And that's what I've been doing. That's what we've been doing for the last 2 years. That's what we teach in our Deprescribing Accelerator, that now is the time to start owning your expertise and getting in front of people who need you, right? And yeah, these facilities are going to be over medicated and have patients on pages and pages of meds. Let's hit the people before it gets to that. Like, let's hit people who may be starting that trial in their late 50s. And, how can we prevent this impending situation where we have an aging population with less care providers, less geriatricians, less beds in the hospital to care for them because they are exhausted and tapped. And honestly, there aren't even spaces in the community to place people so they can be discharged. So now discharges in the hospital system are being backed up. So what does that mean? It means that these nursing facilities, these ALFs, these memory care units, they are all booked and brimmed up with people. They're booked and they're understaffed. They're booked out yet understaffed. So we have less quality of care that are taking place in these facilities. We've got less people who are even able to leave the hospital. What does that mean? It means there's less people who are going to be admitted to the hospital. And so we're going to start shifting healthcare to where we're pushing people away from our traditional hospital revenue generating model. We're going to want people to stay the hell at home. Okay. That's where our aging population, that's where healthcare is going to, is we're seeing changes in the laws for telehealth. We're seeing expansion of telehealth. We're seeing more medical care at home models, patient care centered medical home models. We're looking at a shift in the old way, and we've clearly seen the old way ain't making the money, and it's not working as much as it can. So who better than people who are specialized in understanding deprescribing, understanding how to leverage deprescribing, not just how to monetize it and integrate it, but how to sustainably do it to where we're coaching and changing behaviors within an environment that's conducive and sustainable to the health system and to our patients who want this generally anyway. They want to be taken off of these prescriptions. This it's not something that I think is far-fetched. So the time truly is now for us as geriatric facing nurses and pharmacists and social workers to consider using the power of deprescribing as a way of advocating for our providers who are inundated with the day-to-day of a broken system and may not just have time to understand what precision medicine is or pharmacogenomics or integrative medicine, right? They may not know lifestyle med changes. They may not have the bandwidth, and I get it. So I don't blame providers. I blame a system that rewards bad behavior. And I'm asking us to change the behavior because we're paying so much money for a system that truly isn't equitable and doesn't give you the best outcomes, right? It doesn't give us the best outcomes, period. So that is the intent of the deprescribing movement I am leading. That is the intent of the Deprescribing Accelerator, is to give you a year's worth of information where you're going to take away knowing the immediate tools on how to implement deprescribing. You're going to know the you're going to know the easy tricks for how to advocate against problematic meds in our seniors. You're going to understand how to position yourself in the market in front of the senior care industry and get some referrals, get patients that need your help. Because I guarantee you, all of them are saying, wow, I just see all these people on all these meds and no one's doing anything. No one is doing anything about it. Seriously, I'm talking to home health industry people. I would say the only people who probably talk about deprescribing are, if not a geriatrician, are people in home and hospice, people in hospice and palliative care. They already have it down. That's like their whole world is, all right, let's get you off everything you don't need and keep what you may need. That's it. They already do it. So I want us to think more like deprescribing palliative care hospice folk who already know the lingo. But I'll tell you, in this realm of senior care, everyone's saying the same thing. The people are on way too many meds and no one's touching it. The doctors aren't talking with each other. The health systems aren't talking with each other. The pharmacy isn't talking to the provider and vice versa. There's a miscommunication. Even the medical records on the med list aren't accurate. So there's a bigger issue here where I feel we need to just start incentivizing pharmacists to do this and not just do it within the confines of our other duties of a 9-to-5, but literally do it in a way where you're getting paid for the value that you've given to someone's life. Where you're getting paid for someone to be able to go on vacation and remember, oh, if I didn't have this med review 2 years ago, I would be in a memory care unit right now because they thought I had dementia. You know, I want that level of impact to not just be a rarity in your day-to-day. Like it needs to be, it should be, I feel, the standard of why we do what we do, of why we care for our patients. And so I'm bringing us all home to say, in the spirit of gratitude, this has easily been the happiest year for me. This has been personally one of the best years for me. I've had some losses, but one of the promises I made was to travel. Right, that's like my biggest joy and passion, apart from helping my patients and playing my cello. But travel was like my number one thing that I had to do this year, personally, business-wise, all the above. And so we've all been kind of hunkering down with COVID, but the travel to me is what reminds me of my why and the ability to live a lifestyle that I feel we all need to be exposed to, and it's to see how other people live outside of this country. And so I've been blessed to treat myself, to go on so many business trips, so many conferences, and meet amazing, cool people, passionate people. This was the year I've traveled the most in my entire life. Like, I mean, for me to literally be traveling this much almost every month from being in Guyana. So I'm grateful. I spent 2 3 weeks with my mom, Sandra, in Guyana, helping her get the logistics and building her home. She's building her dream home that she can retire to, her home away from home in South America, Guyana, where my family's from. So I'm grateful I can help her. I can take the time to be international. I could take the time to be in South America and help my mom follow her dreams, right? And even reconnect with all my aunts, uncles, cousins. I'm grateful for that. I'm grateful I spent the beginning of the year in Vegas with my college buddies, playing my first full round of golf. I always go to a driving range, but I'm grateful I could spend that time with the people that supported me 15 years ago without having to ask for PTO, without having to ask permission, without asking for someone to switch shifts so that they can cover my Friday. I'm grateful for that. And I'm seeing more and more that, I'm reminded more and more that that's a lifestyle that everyone has. And I'm grateful. And I am grateful I could say I can put energy to this and be happy, like be the full Delon I think I neglected prior to this business 2 years ago, 3 years ago. I'm grateful I'm able to have patients that trust me with their care, and text me with any concern, any issue, any question. I'm grateful for my COVID task force that, I will easily say I have not been as involved in lately, but I learned so much from the network of being in a community and meeting people where they were and understanding really how this is still crippling and impacting communities of color to this day. I'm grateful for the network of people that have poured into me countless times, whether in passing, whether a complete stranger, whether it's a tip, or whether it was a prayer. Family and friends, of course, have been there through the lows. But I'm thankful for that. I'm thankful for my travels that allowed me to make friends in places I never thought to make. So I'm grateful for that. I'm grateful for the countless pharmacists and nurses who've invested in our Deprescribing Accelerator program. I'm so grateful and proud of them trusting the process and trusting me and being able to coach them through their business journeys. I am so thankful for my dog, who's here now in the office, keeping me busy, Kaya. I'm thankful for this day. Anyway, I'm thankful for a lot, but I am thankful that this journey of deprescribing, of educating and public speaking and empowering caregivers to other clinicians, I'm so thankful that this has given me the chance to, in a way, reshape how pharmacists are perceived and set the tone for the future of value-based care. Like, value-based care has to talk about it. You just can't talk about deprescribing without aligning it with value-based care. It's a value-based care service. It's an invaluable value-based care service that can be monetized and can be sold. And that's what we specialize in with our Deprescribing Accelerator. We're teaching clinicians who are geriatric facing and want to do something different against this health system. They want to make their own waves. They're looking to monetize and leverage their brand in doing so. And they're looking to put out a way that is contrary to what our health system wants us to think is the only way to treat people. And there's several avenues for that. But we're focusing on the aging population in our course, in our 3-month course. And I'm grateful to show that now is the time for you to realign what is off in your world with what brought you to this profession to begin with. What brought you to this profession to begin with. And that's what I'm grateful for. That's the biggest takeaway, is how we cannot continue in our own states of unhappiness or unwellness and expect things to change just because we want things to change. Like, you have to take action. You have to put some faith in yourself, and even some faith in the process of trying to do something that you really care about. And I think it starts with just serving. Just show up, volunteer, and if it's something you love, you're gonna rekindle that passion. And I don't think it has to be healthcare related. It could be you making sandwiches at a food bank, or cooking, or something. There's so many things that need help in our neighborhoods. So that was how I was able to try to figure out, okay, how do I get back to the Delon that was, or thought they were happy, at least when I first got into pharmacy, and how do I pivot that to solving a problem that a lot of people have and would like some support with. And that's where the concept of me selling Deprescribing as a cash-based service came from 3 years ago. So I have to give a shout out to those who poured into me. Dr. GeriatRx. I got the idea of the concierge pharmacist from actually RX VIP concierge. So that was Ken Sternfield and his group. And they changed the name, but that was when I was first trying to figure out, what is concierge pharmacy? What does that mean? What does that look like? So in the beginning, I was just kind of looking up who was doing like coaching stuff and non-traditional pharmacist stuff. And in the beginning, there were like a couple of names. There was Kevin Yee, I used to follow on YouTube. He had quite a bit of talks. He was a pretty popular pharmacist and had a pretty successful podcast in the early 2017 or so. There was Blair Teelmeyer, who had, of course, her course, and opened my eyes to what could be possible. And then there was Ken Sternfield, and then I guess I mentioned GeriatRx, who was my most recent coach, who told me about the impact of telling my story. So, what were all Google searches when I was in pharmacy world? Ended up turning into, pseudo mentors, pseudo ideas, pseudo seeds of growth that got me to talking about the senior space in the geriatric care, and how pharmacists are well equipped to be everyone's caregiver advocate, patient advocate, deprescribing advocate. And so that's why I'm here today. And now is the time. Now is the time. Now is the time to start putting yourself out there and doing what you love. I mean, just do what you love. I can't stress how much happier I am in doing a couple of things a day with a decent, I can't lie, a pretty good work-life balance. And I just want that for everyone. I want that for all of us who are kind of just sick and tired of being sick and tired, where I was. And yeah, I just want to show that this is a world that you can take control of your own fate, and you can do it in a way that helps impact others' lives. So now is the time to start deprescribing for the sake of our seniors who are aging longer and have less and less people to care for them. There's gonna be a need for businesses that literally just deprescribe. that is where the future of medicine is going. Because we're spending too much with what's going on now, which are polypharmacy, prescribing cascades, duplicate therapies, gene drug interactions, a lack of holistic care, a lack of integrative medicine. We're spending so much and still getting little bang for our buck. We are at a point in healthcare where we have to shift away from this model. We have to shift. And that's why deprescribing needs to start now in order to save these lives, in order to reduce unnecessary expense, to show people how you investing in your health now can save you spending 6 figures a year in that nursing home if we just get some of these things right. So that is something that I know for a fact is powerful and is being done. I just feel it's being done in silos. It's not being done on a national scale. And it will be done if our HEDIS measures are starting to shift and talk about deprescribing. For instance, deprescribing of benzodiazepines will be a new HEDIS measure going into 2023. And they'll be looking for the decrease in dose. I think about 20% decrease in the dose of the medicine being used. They're going to look for decreases in that as a HEDIS measure. So if NCQA, the National Committee on Quality Assurance, the people that accredit insurance plans and home health agencies, and if these people are the ones who set the bar and standard for quality care, and they're talking about deprescribing, then yes, CMS is going to follow. Private insurers are going to eventually follow. Commercial insurers are going to follow. They're going to start aligning with that as they are suddenly caring about health equity, right? Because that data is now becoming required to report. And so we're seeing a shift in people now talking about those disparities, using the data and using that data to drive and bridge those gaps to disparities. So the future of deprescribing is bright. It is, however, starts now. It starts with those who are in this space, who are already doing it, and just a little pivot to how they're providing that care can go a long way for our health system. And so that's what I want for everyone. And that's why I wake up grateful every day, knowing that there are more people that we can help using a different approach, and knowing that I can help coach like-minded and passionate clinicians to get to that result using our 3-month Deprescribing Accelerator program. So we're currently recruiting for 5 people for our next cohort, 5 clinicians, 5 pharmacists. As long as you're geriatric trained or at least have a passion for working in the geriatric space, we're looking for nurses, pharmacists, and social workers, and senior care businesses who want to pilot deprescribing and learn how to implement and monetize it with education, with empowerment, with really easy to follow step-by-step tools that we'll provide for you as a part of our program. We've got alumni. We have a community of people that are deprescribing advocates, certified, patent pending, started trademark, so don't try to steal it. Yeah, so I'm excited for where our profession's going, but deprescribing needs to be the talk of the town, and I make it so that others can start doing the same, because we already kind of do it. Let's just make it loud and proud, and let's put it in front of the people that need it the most, because they don't know that there's an option to be deprescribed. We've been conditioned to think everyone needs to be on a pill forever. So it does take some education. It does take some sweat equity, some energy, some effort to go proclaim to the masses how we can truly help save your life with knowing the meds, knowing the interactions, knowing ways to get you off the meds, and then giving that peace of mind to the patient and caregiver, but also to the provider, because now they know okay, these meds are good. I mean, that's not the issue. Let's rule this out and go to another issue. So the time is now. We will start our next cohort for the Deprescribing Accelerator likely in February of 2023. We're currently interviewing people as we speak. And so I'm looking for 5 clinicians, 5 geriatric facing clinicians who are tired of this over medicating crisis we're in, who feel helpless when they try to bring up these concerns. We're looking for people who are looking to develop their own way, their own brand, their own namesake, using deprescribing as a tool to serve. It's just a tool to serve. It's one of our best kept secrets to serve. So I need nurses who care about seniors, and I need pharmacists who absolutely care about seniors. Because if you don't have a baseline empathy or level of concern or care, this is not the program for you. If you're looking to get a quick buck out of your community, this is not the program for you. We'll teach you how to potentially make the money, but we're not doing it for the money. We're doing it to give you a way to, yes, sustain yourself, but also realign why you came to the profession with doing what you love. And we like to get people off of pills. That's like one of our guilty pleasures as pharmacists. So if you are ready to take this time and energy to reframe your thinking on starting that business, starting that plan, making that leap, trusting yourself, trusting a process that'll give you easy to follow steps to leverage deprescribing and monetize it, then sign on up. We're doing this to show how we could serve. I invite you to apply. We have an application link in the comments where you can learn more. And there's a link at the bottom of the page where you can schedule a meeting with me, and that will be a part of our interview to see if you'll be a best fit for our cohort. But the time is now. The time is now to start deprescribing, to get our energy back, to get our profession back, to start marketing deprescribing as a service, as a high ticket service. That is what we do here. That's what we teach our alumni to do. And that is what our communities honestly need. So I hope this was helpful. Today we went all over the place. We went from gratitude to deprescribing, why the time is now, to why I'm happy every damn day. And I want that same joy for you. I want that for everyone, frankly, because life is too short. So you guys enjoy the rest of your Thanksgiving week or weekend, and we will catch you next time for our episode of the Red Pill versus the Blue Pill. Much love and take care. Have a good one.